Hi everyone, my name is Courtney and I'm one of the new physiotherapists here at Vector Health. Just jumping on for a quick video today just to have a bit of a chat around ankle injuries. That's something that we very commonly see coming through the clinic here. So ankle injuries are very common, especially in jumping sports or sports where you're having to run and change direction, but it's also just so easy in everyday life to sort of roll or sprain your ankle on an uneven surface or sort of going up and down stairs. So just a really general video today, just explaining a little bit about the injury, the management process, and what we can do from a physiotherapy point of view as well. So the most common ankle injury that we see is just what's known as a lateral ankle sprain. So that's when you're sort of like on the outside border of your foot here and your foot sort of rolls under that way. So especially coming down on an uneven surface in jumping sports, when you land on somebody else's foot, you sort of roll that way. And that's what we call a lateral ankle sprain. On the outside of our ankle there, we've got sort of three main ligaments, the ATFL, the CFL and the PTFL. That's probably quite familiar to people that have rolled their ankle in the past. And most commonly we see that first ligament at the front there, the ATFL, that gets injured most commonly. So as physiotherapists, what we do, our job is to sort of diagnose that injury, to be able to pinpoint what sort of ligament or what sort of structure has been injured. And because we are also like a non-referral based profession as well, we also can sort of screen for if anything major has happened. So if there's any sort of fractures or anything like that, we have certain screening tests that we carry out before we move any further, and we can refer you on for x-ray and things like that as well. So that's really important that we can pick that up too. So it's probably quite clear for people that have injured their ankle in the past, you'll as soon as you've done it, you'll experience things like pain, swelling, bruising, redness. Some people can't put their full weight through that side anymore, so that's like pretty clear indicators that that's the injury. In the acute phase of the injury, in the first 1 to 3 days afterwards, it's really important that we're being quite careful because that is when it is quite sore. So looking at our RICE, our rest, ice, compression and elevation is really important. With our icing, that's going to really help with the swelling, bruising and also just pain as well. It really helps with that. So looking at 15 to 20 minutes on and then take it off for a couple of hours and then it can go back on again, but that's sort of your optimal ice time there. And the other really important thing is just avoiding some things with the acronym is really easy to remember, HARM. So we want to be avoiding heat, alcohol, re-injury, and in the really early phases as well, massage. So the next phase of an ankle recovery is called the repair phase, I guess, from 3 days up until about 15 days. So just post the acute phase there, and then a couple of weeks after that is where a physio plays a really big role in ankle rehab. So we've got things like stretching of certain muscles, strengthening of the area, some joint mobilizations which a physiotherapist performs just to get the joint nice and free and moving again, because naturally it will get quite stiff. Proprioception is another really big one, so sort of where the joint is in space. Shoe assessments and taping and bracing, of course, are other really big ones that we can look at as well. The last phase of our ankle recovery is called the remodeling phase. So we're looking at that time frame to be around 2 to 4 weeks. And that's when we sort of can get really fun with our exercises as well. So that's when we get back into our running and jumping, our multi-directional changes, agility, any sport-specific movements that you need to be really comfortable with to get back to your sport. That's when we can really have that strength built up, that we can get back into those really more agile sport-specific movements. It is really important to note that at around 3 weeks post-injury that you are only at about 60% strength, and then they say at about 3 months that you're back to about 100% strength. So especially during these last phases of your rehab, it's really important to stay in touch with your physio, especially when we are getting into these higher velocity movements with the directional changes and when it becomes a little bit more sport specific, just to make sure that you're returning at a time that's sort of safe for you as well. So we know that around 30% of people are at risk or re-injure after having their initial ankle injury or sprain. So that's why this process is really important to do well the first time. You really want to have a good rehab the first time round to prevent yourself from further re-injury, especially when you're doing your sports and things like that as well. So I hope this information that I have touched on today really helps a lot of you guys out at home. Today we've touched on the three main phases of rehabilitation, so the acute phase, the repair, and then the remodeling. So that was really the focus of today's video, so that you could sort of have a little bit of a snapshot into what ankle rehabilitation is like, especially when you sort of come through the proper channels and see a physiotherapist. I hope that makes the rehabilitation process a little bit clearer for you. And if anyone sort of feels like this is a process that they're going through at the moment, please feel free to get in touch with us, and one of the physios here would be more than happy to help you out.